Hey, I want to share an update of everything that's going on because it's been crazy, and I think that sharing this will be kind of knowledgeable for all of you and maybe helpful for some of you. But it'll also help me process and integrate all the information coming in, and it's coming in like wildfire. Um, for the last 5 weeks, I've been fighting an infection predominantly in my head, which made the systemic infection virus that I've had since birth return to my body. So I was doing ozone treatments. I had 20 sessions of ozone treatments. It was very effective. It basically eradicated this virus from my body and got rid of arthritis. The PCR test came negative. Everything was looking sweet. And then I am also off of all my medications, all my biologics injections, prednisone, which is a steroid, and also methotrexate. So I went through the whole steroid withdrawal process, which was like 8 months. I couldn't work. All my hair was falling out. That's why I cut my hair. Um, and so everything was stabilizing, everything was good. I got the go ahead that I'm free of this disease. And then over the holidays, I get this really weird infection in my head. I go deaf in both ears. I start having crazy migraines, chronic sinusitis, a horrible cough. It was difficult to swallow, so I had like a swollen tonsil, a swollen lymph nodes. Um, what else? Like I lost my appetite, like just so many things were going on, and I've been sick like that for 5 weeks. So when I went to see my specialist at the Chelation Center in Barrie, his name is Dr. Huey, and he's an alternative health practitioner. He was really curious to understand why did this infection come back after a negative PCR test, no more arthritis, my blood is clean, what's going on? So he starts feeling around in my mouth, and we discover that I have a lot of sensitivity in the back part of my gums, on the bottom and the top, where I had my wisdom teeth extracted 6 years ago. And then I start to clue in. I'm like, maybe I should tell him about this infection. Maybe it's all connected. So I start to tell him about all my symptoms, like I'm deaf and migraines, and like I have COVID and strep throat and a virus, and it's been 5 weeks. What the hell's going on? Why am I so sick? And he was like, I believe that you have an infection, a long-standing infection in your gums where you had the wisdom teeth extracted. And he asked me, how was that experience? And I was like, honestly, it was one of the most traumatic things I ever had to live through. I had dry socket 3 times. I had pieces of bone fragment left behind. I had to have multiple surgeries to remove these bone fragments. It was just tampered with so much. And I remember being very sick and on painkillers for a year and a half after that procedure. And it was so traumatic, and it was so dark and so painful that my memory has actually blocked it out. Like I can't remember the pain. When I think about that time, it's just black. Like I can't remember it at all. And so he was like, you need to go to a specialist right away. He's like, I believe that there's an infection going on which creates these pockets where it putrefies, and that becomes an excellent host and a breeding ground for this lifelong virus that you've had. Because with ozone therapy, what they do is they take out my blood, so they go intravenous, they pull my blood out, and they ozonate it, and then they put the blood back in my body, and they do this 10 times. So it takes about an hour. They're ozonating my blood, and what happens is they're actually killing and fighting off bacteria and viruses that are living in my bloodstream. But the problem with pockets of infection, the bloodstream doesn't have access. It can't penetrate that area. So his theory is that even though we got rid of this infection from your bloodstream, it was still living and incubating in this area, and that's why it has re-entered your bloodstream. That's why you went through this very severe flare-up. And I'm going to tell you just briefly how bad it was, because now I'm not on medications, right? And then I took a week off of ozone because I thought I was in the clear. So I had no protection whatsoever, and this infection came back, and it went ballistic in my knees. And then it traveled up my spine and in my hip, so I was not able to walk for 8 days. I was in excruciating pain. It went in my wrist, my fingers, my hand, my elbows, my shoulders. I was full-blown arthritic in my entire body. unable to walk. And so, like my recent treatment, which was earlier this week, I had the ozone therapy, the 10 pass, and I also got ozone injections where they go like deep in between the kneecap and they fill it with ozone gas. And that effectively eradicated the bacteria, the virus that was in my knees. So immediately the pain went away, which is super awesome. And the inflammation overnight went down by 50%. So the next morning, which was yesterday, even though I still had inflammation in my knee, it was gone by 50%. So I was actually able to walk for the first time. And then yesterday I went to my rheumatologist and I had both my knees drained. So they pulled all the fluid out with a syringe and then they filled me up with cortisone. And for me, cortisone was essential because it's systemic. I don't like to get it unless it's like absolutely necessary. They put the cortisone injections in the knee, which kind of suppresses this inflammatory response, but then that moves through my whole system, and so it starts to do its work everywhere: my shoulders, elbows, wrists, hands, fingers, ankles, hips, spine, everywhere that I've been having the inflammation. So, as it stands, like right now, I'm stable. And I can't believe it, like, because it was so scary. I've never been this bad. I've never been this arthritic. So I'm super grateful. Thank you for all your love, all your kind words, all your prayers. Everything is so much received, so well received. It gave me a lot of strength during this time because I was really, really scared. And so today I had a follow up with this specialized dentist because my specialist in Barrie was pretty certain of his theory. So he sent me to a specialist who believes in cavitation and infections post-surgery from root canals and from wisdom teeth extraction. So I went all the way to Hamilton at the Estrabilo Dental Group Clinic, and we did rigorous extensive testing, which was like 4 hours. We did everything you could think of. I did a cone beam scan. I did like a pressure bite scan. I did an MRI. We looked at everything, and just from those results, he was able to effectively identify that, in fact, I have 3 infections going on where my wisdom teeth were extracted. Incredible. Unfortunately, cavitation is a highly controversial thing in the medical field, and they like to call it misinformation. And so the reason why it's controversial is, number one, wisdom teeth extraction and root canals make good money. But the other thing is that if you believe in cavitation and infections caused by root canals, then that means that it's a practice that needs to die because it's causing a lot of harm to people's health. And this really goes against the scientific opinion. It has the potential to ruin their reputation, their scientific studies. And so there's a huge fight between dentists and doctors that don't believe in this and the very few that are looking at the research going, it's very real. And so unfortunately, my practitioner is not allowed to practice cavitation, even though he used to. They fought really hard against him, and they made him sign a document like saying that he will not practice cavitation, and if he does, they'll take away his license. This is happening all over in so many different medical professions, and it's really scary because in the meantime, people are getting autoimmune diseases, cancer, their organs are failing on them. They have all these incredible symptoms like migraines, depression, brain fog, anxiety, like just they're experiencing so much chronic pain, and doctors, dentists are not helping them. So there are very limited options for me right now. If I really want to have this area cleaned out, I need to go into surgery. They're going to cut me open and take a biopsy and then sew me back up. I'm going to have to wait for this biopsy to come in, and if they can prove that I have microorganisms in there, putrefying, bacteria, infection, all that, then they will do a second surgery to clean it out. What a waste of time, and why should I go through the trauma of going through 2 major surgeries? Like, why? That's just insanity to me. And then other options that I have would be to go to Alberta, Ohio, or Texas to a practice, a private practitioner who practices this method. It's insane. It's insane that this is what we have to do to look out for our health. And I know that I'm struggling so much because of this. And I know that if it wasn't for clean nutrition, optimal diet, gut health, like organic, whole food, glyphosate detox, all these things that promote the immune system's function, A, I would not be off of all my medications, including steroids, and B, there's no way I'd be able to talk to you right now. I would be so sick. I could not fight this. I could not even advocate for myself. So nutrition is like the bedrock, the foundation. The Purium lifestyle continues to be everything that I need it to be. If you're fighting infections, if you're trying to heal from surgery, like if you have something chronic going on, the first thing that you can do that's accessible is follow a healthy, organic, whole food lifestyle that addresses your gut health and detoxes glyphosate. So I do have information on this and I'm happy to share it some other time. That's a conversation for another day, but if you do want more information or you want to be hooked up with this lifestyle or you want to see how it can help you, I am happy to share that information with you. So just reach out to me. So thank God for the Purium lifestyle, because without Purium, I would be bedridden. I would not be fighting this infection at all because I have something going on in my head. And what happens with infections that are in your jaw is that your immune system is doing everything it can to prevent the toxicity from going up into your brain. So it makes sense that all these other infections, like this lifelong virus I've had for 18 years, is so opportunistic to take over my whole body, because this infection is really just taking everything it can to focus on me not, dying or having other severe complications. So that's kind of how it works. There is a documentary, used to be on Netflix, but again, because it was said to be misinformation and a lot of scientists are trying to protect their reputation and their work, they got it removed from Netflix. So this documentary is called The Root Cause, and you can watch it for free on YouTube. I highly recommend it. It's so informative, and it talks about how every single tooth has a meridian system connecting to your organs. And so when you have an infection like a root canal or a wisdom tooth extracted, and it's not properly cleaned out, or it's blocked with metal, or it's blocked with an infection, this electrical current can't move through the certain organs that it's tied to, that it's connected to. And so wisdom teeth are directly connected to adrenals, thyroid, and a bunch of other organs on this side. And I've had adrenal failure and thyroid failure. And those are like two incredibly important hormones. They're like 2 of 3 of the most important hormones that run your whole body. And so it's kind of interesting that I'm having all these symptoms in my head, this massive flare up and return of this virus, plus adrenal and thyroid failure. And then we're discovering that, my wisdom teeth are the source of the issue. My other concern is that with ozone therapy, it will clean the blood. But like I said, it can't get into pockets inside like bone and tissue. And so I want to address the gums, but I also have spina bifida at my S1 in my spine. And so spina bifida, I'm actually missing a piece of spine. And so the nerves can come out of the pocket. My question is, can this virus hide inside the S1 area? And that's something to explore with my specialist. And then another thing that I need to explore is my GI tract to see if there's any kind of lingering infection in the GI tract, and also if I have the right flora in there in the first place. Because if I don't, then of course that's going to be difficult for my immune system to function optimally. So there's still so much investigation. Now, with my follow-up with the dentist today, we were looking at everything, and that's basically what he told me. He was like, unfortunately, you can't find anyone in Ontario that will practice this. If you want surgery on this infection, they need proof. So you'll have to have 2 surgeries. Otherwise, you can go to Alberta, Ohio, or Texas to a private practitioner who will clean it out. I took notes actually. Sorry, that fell over. Where are my notes? Oh, yes. Okay, so this is really important when I'm going to have the surgery, whether I decide to have the surgery here or whether I travel to do it. The question is, how are they going to clean it? And so what my dentist practitioner used to do when he was doing this cavitation surgery is he would cut open the area, go inside, clean everything out, scrape the bones, scrape the tissue, and then with laser clean everything out. And then to ensure that the infection is gone, he would inject it with ozone gas. And ozone gas is incredible for removing the infection because the gas can travel through all the micro pathways where the bacteria can kind of like wiggle through and hide in. So just because like you scrape the area and then you wash it out and clean it out doesn't mean the infection's fully out, because there's micro pathways and bacteria are small enough to go into these micro pathways. Like I'm pointing, but like it's microscopic, deep, deep, deep in here. Right? And so when you inject ozone gas, it travels through these pathways and it just eradicates all the bacteria that's in those pathways. If you want like a better visual of what that looks like, I highly recommend you watch The Root Cause on YouTube. So I'm getting really good at advocating for myself, asking the right questions, being really assertive, not taking no for an answer, because this is my health. I don't have time to wait, you guys. I need to work. I need to go on with my life, right? So I really am pushing for my health here. So if you guys have like any questions regarding anything that I'm going through or how this can support you, I'm super passionate about this. I think that there is a reason I'm going through this. I think that it is allowing me to access so much information and get so many resources and health practitioners, in my life and my experience, so that I can share this with all of you. So please don't hesitate to get in touch with me. Ask me anything you want. I'm happy to share. And if you do watch The Root Cause, please get in touch with me and tell me what you think about it. I'm so curious because we got to look for our health. They're not looking out for us. They're trying to protect their reputation, their scientific dogma, but it's outdated. And so if we want to make the change, if we want to look out for health, it's up to us. So I'm really curious to hear what you guys have to say about that documentary. Okay, and again, thanks so much for all the love and support. I really appreciate it so much.